be educated.
Hello. Welcome to Caring Heart once again. I am Venice Odudu and I'm the founder of BOI Learning Partner. A typical nurse work day can be very challenging. The stress of coordinating multiple tasks in a shift can be overwhelming for a nurse who has been working for some years, and more so for new graduate nurses who just got off orientation, or an internationally trained nurse who is unfamiliar with the healthcare environment of the country where she works. Today, I'll be providing some insight on how to tackle 3 challenges which could make a new nurse doubt if the nursing profession is the best option. The first threat is threat of difficult assignment. The second threat is threat of toxic co-workers. And number 3 is dealing with challenging behavioral patients. It is very important to arm yourself with the strategies to address these threats prior to the start of a new nursing career. If you wish to learn more about how to tackle these threats, you can click the link in the description box below. Now, the first threat. Difficult assignments. Sometimes new nurses encounter unfair assignments. This can be very challenging. A client of mine recently shared an encounter actually, about her first day of orientation in a medical surgical unit. Among the 5 patients she received, one had tracheostomy tube, which needed frequent suctioning. The second patient had order for blood transfusion. The third patient was a behavioral patient, yelling at everyone, including the physician. The fourth patient needed antibiotics, but the IV got infiltrated. And of course, she was the first admit that day. According to her, she was so confused and overwhelmed that she did not know what to do and how to start these tasks. She couldn't ask for help for fear of being termed incompetent. None of the routine tasks were completed. The document was incomplete per the nurse. She went home fearing if she could continue with the nursing career. When you encounter such situation, please speak out in a professional way. When you notice your assignment is overwhelming, never be afraid to consult your supervisor or a more seasoned nurse when you need clarification or advice. They have knowledge on how to prioritize tasks and give advice on how to manage workload. The stress of juggling multiple tasks at once is common among newly graduated nurses. It is therefore important to set your priorities and effectively organize your tasks. The demands and the urgency of the patient should guide the way to initially prioritize your workload. Make use of a to-do list to arrange your workflow and to help you keep up with your tasks. You may want to view each task as a chance to expand your knowledge. Think critically about what you have done, figure out what you can do better, and learn and grow so you can handle wider variety of patients' assignments. The second threat for today's nurse is toxic co-worker. Just like in every spectrum of life, you will find people who will not just like you the first day you step on the unit. It is not about them as a person. It is about their personality. When dealing with toxic co-workers, keep your cool and act professionally. Stay focused on your tasks and stay away from bad talks and gossips. Keeping a pleasant mindset and remaining neutral are important. Pay attention to supportive co-workers. Get to know encouraging co-workers and mentors who can be your to-go person for your concerns. Having a helpful support system can help lessen the impact of toxic conduct. It is also important to draw a line when dealing with toxic workers. Avoid getting involved in any drama or bad situation. As politely as possible, stay calm and always collected. And limit your conversation to issues relevant to work. Number 3 threat is dealing with patients with challenging behaviors. This situation is common occurrence, especially in high census areas where patients have to wait for considerable amount of time to receive service or care. Effective communication skill is an important key for dealing with patients with challenging behavior. Dealing with patients who exhibit difficult behavior symptoms require open and honest communication. If you want to de-escalate a situation and establish rapport, speak calmly and empathically. Pay close attention while they talk and acknowledge and validate their feelings. Recognize triggers. Make it a point to learn what triggers off patients' behavior and concern. Work together with your healthcare provider to establish plans and routines for proactively dealing with these triggers. Do not wait until the patient gets out of control before you act. Follow your facility policies and procedures or behavioral management. Please seek self-care and support. It is important to remember to take care of yourself when dealing with difficult patients. Mindfulness, frequent pauses, and debriefing meetings with co-workers or bosses are self-care practices. Take breaks. Should you need help yourself, reach out to employee assistance program in your organization. You can also consult a counselor or join a peer support group to help you find some balance. These obstacles can be overcome by nurses facing this stress through self-care, organizational support network, continuing learning, and effective communication. Thank you for watching. If you do like my channel, give Caring Heart a thumbs up. Like, share, and subscribe. And remember, a caring heart makes a difference. See you in the next video. Bye.
I wish I knew